You don't have to feel dizzy for your balance to be changing. That is what makes this problem so easy to miss after 60. You may not feel the room spinning. You may not feel faint. You may not have what most people would call vertigo. But something still feels different. You stand up and pause for a second longer than you used to. You walk across a parking lot and feel a little less sure of your footing. You turn in the kitchen and reach for the counter without really thinking about it. You go down the stairs more carefully. Or you notice that walking at night, even inside your own home, feels less automatic than it once did. And because there is no obvious dizziness, many people explain it away. They say, well, I'm just getting older. But that may not be the whole story. Feeling off balance without feeling dizzy can be a quiet body signal. It does not always mean something serious is happening, but it can mean that one or more of the systems that help you stay steady is no longer working as clearly as it used to. And here is the hidden part. Balance is not controlled by just one thing. It is not only your inner ear. It is not only your legs. It is not only your eyesight. Balance is a conversation between several parts of the body. Your eyes help your brain understand where you are. Your inner ears sense motion and position. Your feet tell your brain what kind of surface you are standing on. Your ankles, knees, hips and muscles make tiny corrections every time you move. Your nerves carry those messages. Your blood pressure helps keep blood flowing to the brain. Your blood sugar helps keep your body fueled and alert. And your medications can sometimes affect reaction time, coordination, or steadiness. So when your balance feels off, the question is not simply, am I dizzy? A better question is my body still sending clear signals to my brain? That is why this symptom can be so confusing for older adults. Many people expect balance problems to feel dramatic. They imagine spinning, nausea, collapsing, or a sudden medical emergency. But balance changes are often much quieter than that. They can feel like hesitation. They can feel like needing to touch furniture more often. They can feel like your feet are not giving you the same confidence they used to. They can feel like your body reacts just a little slower when you turn, step, or recover from a small misstep. That matters because balance is closely tied to independence. It affects how safely you move through your home, how confident you feel outside, and how much freedom you have in daily life. Not every balance change leads to a fall, and not every unsteady feeling means disease. But after 60, a change in balance is worth paying attention to, especially if it is new, getting worse, or starting to change what you do. One of the biggest misunderstandings is thinking that balance and dizziness are the same thing. They are not. Dizziness usually means a sensation such as spinning, lightheadedness, or feeling like you might pass out. Balance is different. Balance is your ability to stay upright, move safely, and adjust when your body shifts. You can be dizzy and off balance, but you can also be off balance and not dizzy at all. That is the part many people miss. They think, since I'm not dizzy, this must not be something to bring up. But balance can be affected by the eyes, the feet, the nerves, the muscles, the joints, blood pressure, blood sugar, and medication effects. One overlooked reason is something called proprioception. That word sounds technical, but the idea is simple. Proprioception is your body's position sense. It is how your brain knows where your feet, ankles, knees, and hips are without you looking down. When you walk across a room, your brain is constantly receiving information from your feet and joints. It knows whether the floor is flat, uneven, soft, hard, slippery, or slopped. It knows how much pressure is under each foot. It knows when your ankle needs to adjust. It knows when your body needs to shift weight. You're not thinking about any of this. It happens automatically. But with age, those signals may become less sharp. The joints may become stiffer. Muscles may become weaker. Nerves may not carry sensation as clearly. The feet may not feel the ground as accurately. And when the brain receives less reliable information, balance can start to feel uncertain. This is one reason a person may feel fine walking on a smooth floor in bright daylight, but less steady on stairs, grass, uneven pavement, or in a dark hallway. In those situations, your body needs sharper feedback. If the feet and joints are not sending clear messages, your brain has to work harder to keep you steady. Another possible reason is nerve change in the feet. This can sometimes be related to diabetes, prediabetes, vitamin deficiencies, certain medical conditions, alcohol-related nerve damage, or other issues that should be evaluated by a qualified healthcare provider when nerves in the feet are affected. Some people notice numbness, tingling, burning, or unusual sensitivity. Others describe it as feeling like their feet are not fully connected to the floor. But sometimes the first clue is not pain, sometimes it is balance. Your feet are like sensors. They help your brain understand the ground beneath you. If those sensors become less reliable, your brain has less information to work with. You may not feel dizzy at all, but you may feel less confident when walking. This is especially important for people with blood sugar problems. Diabetes-related nerve damage often begins in the feet. Over time, reduced sensation can affect walking confidence and fall risk. That does not mean every balance problem is diabetes. It does not mean every person with unsteadiness has neuropathy. But if balance changes appear along with foot numbness, tingling, burning, or reduced sensation, it is worth asking your doctor about. Vision is another major part of balance. Most people think of vision as something used for reading, driving, or recognizing faces. But vision also helps your brain know where your body is in space. When lighting is poor, when glasses are outdated, when cataracts affect clarity, or when depth perception changes, balance can become less reliable. This is why some people feel more unsteady in dim hallways, bathrooms at night, movie theaters, or unfamiliar places. Your body may be using vision to make up for weaker signals from the feet or joints. So when the visual information becomes less clear, the balance problem becomes more noticeable. The inner ear can also be involved, even when there is no classic spinning sensation. Inside the inner ear is the vestibular system, which helps your brain detect motion, head position, and spatial orientation. With age, illness, some medications, or certain inner ear disorders, that system may become less reliable. Some vestibular problems cause obvious vertigo, but others may create a more general feeling of imbalance, especially when turning the head, walking through busy environments, or moving from one surface to another. The important point is not that the inner ear is always the cause. It is that the inner ear is one part of a larger balance system. Muscle strength is another piece that often gets underestimated. After 60, even a small decline in leg strength can change how steady you feel. The hips, thighs, calves, ankles, and core muscles all help the body recover when it sways or steps unevenly. Balance is not just about standing still. Balance is about correction. Every time you walk, your body makes tiny corrections. If the muscles are weaker, slower, or more fatigued, those corrections may not happen as quickly. That can create the feeling that your balance is off. Even when your head feels clear, joint pain can add another layer. Arthritis in the knees, hips, ankles, or feet can change the way a person walks. Pain may cause shorter steps, uneven weight shifting, or hesitation. Over time, the body may develop a more guarded walking pattern. And when walking becomes guarded, balance often feels less natural. Blood pressure can also play a role. Some people feel unsteady when they stand up because their blood pressure drops. This can cause lightheadedness, blurred vision, weakness, or the feeling that they need to hold on for a moment. But not everyone uses the word dizzy. Some people simply say, "I feel wobbly when I get up." This pattern can sometimes be related to dehydration, medications, heart issues, nerve conditions, or other medical concerns. It is especially important to mention it to a healthcare provider if it happens often, causes falls, or comes with fainting. Blood sugar is another possible factor. For people with diabetes or blood sugar swings, low blood sugar can sometimes cause shakiness, weakness, confusion, sweating, or loss of balance. And over time, high blood sugar may contribute to nerve damage in the feet. This is why balance should not be viewed as one isolated symptom. The body is connected. Feet, nerves, circulation, blood sugar, vision, strength, and medication effects can all overlap. Medications deserve careful attention. Some medicines can increase the risk of unsteadiness, sleepiness, slowed reaction time, dizziness, or low blood pressure. This can include sleep medications, sedatives, some anxiety medicines, some antidepressants, some blood pressure medicines, some pain medicines, and certain over-the-counter products. This does not mean these medicines are wrong for you, and it does not mean you should stop taking them. But if your balance changed after starting a new medication, changing a dose, adding a supplement, or combining several products, it is worth reviewing the full list with your doctor or pharmacist. Supplements can matter too. Some can interact with medications or cause side effects in certain people. And while certain deficiencies may be relevant to nerves, muscles, or fall risk, it is safer to ask about appropriate testing instead of guessing. Now, the useful question is, what pattern are you noticing? Does the unsteady feeling happen when you first stand up? Does it happen more in the dark? Does it happen on stairs? Does it happen when you turn your head? Does it happen on uneven ground? Does it happen when your feet feel numb or tingly? Does it happen after taking certain medicines? Does it happen when you have skipped a meal, feel shaky, or feel weak? Those details matter. A balance problem that appears mainly when standing up may point in a different direction than one that appears mostly in low light. A balance problem with foot numbness may suggest a different issue than one linked to head movement. A balance problem that begins after a medication change may need a medication review. The more clearly you can describe the pattern, the more helpful that information can be during a medical visit. There are also warning signs that should not be ignored. If balance problems are sudden, severe, worsening, or causing falls, they should be discussed with a healthcare professional. Seek urgent medical help if unsteadiness comes with sudden weakness on one side, trouble speaking, facial drooping, confusion, chest pain, shortness of breath, fainting, a severe new headache, sudden vision loss, or sudden difficulty walking. Those symptoms can point to more serious problems and should not be dismissed as aging. For balance changes that are less urgent but persistent, it is still worth making an appointment. A doctor may want to check your vision, blood pressure, feet, nerve function, medications, blood sugar, strength, walking pattern, or inner ear function. The goal is not to panic. The goal is to understand what has changed. There are also practical habits that may support steadiness, though they should not be treated as cures. Make your home easier to move through. Better lighting, clear walkways, secure rugs, handrails, and safer bathroom surfaces can reduce fall risk. Pay attention to footwear. Shoes that fit well, support the foot, and reduce slipping may help you feel more stable. Keep moving in a safe way. Strength and balance exercises can help maintain the muscles and coordination involved in walking, but if you already feel unsteady, it is wise to ask a healthcare provider what kind of movement is safe for you. Hydration may also matter, especially if standing up makes you feel weak or lightheaded. But fluid needs can vary for people with heart, kidney, or blood pressure conditions, so it is best to follow medical guidance. Sleep is part of the picture too. Poor sleep can affect alertness, reaction time, and coordination. If you wake often at night, feel groggy in the morning, or take medications that make you sleepy, that can affect balance during the day. Nutrition matters because muscles and nerves need proper support. But balance problems should not be reduced to one food or one supplement. A balanced diet, regular checkups, and appropriate medical review are safer than guessing. Perhaps the most important step is simple. Tell your doctor exactly what you are noticing. Do not just say, "I'm getting older." Say, "I feel unsteady when I stand up." Say, "I feel less balanced in the dark." Say, "I've started touching the wall when I walk down the hallway." Say, "My feet feel numb, and I feel less sure when I walk." Say, "This started after a new medication." Those details can change the conversation. The main lesson is this: if your balance feels off, but you are not dizzy, your body may still be sending you an important signal. It may involve your feet. It may involve your vision. It may involve your inner ear. It may involve muscle strength. It may involve blood pressure. It may involve blood sugar. It may involve medication effects. Or it may be several small changes happening together. After 60, balance is not something to ignore, but it is also not something to fear. It is something to understand, because staying steady is about more than avoiding falls. It is about confidence. It is about independence. It is about moving through your day without feeling that quiet uncertainty under your feet. So if your balance feels different, even without dizziness, do not dismiss it too quickly. Notice the pattern. Review your medications and supplements with a professional. Check your vision and your feet. And talk to your doctor if the change is new, persistent, worsening, or affecting your daily life. Your body may not be shouting, it may be whispering, and sometimes that quiet signal is the one most worth listening to. If this explanation helped you understand what your body may be telling you after 60, subscribe for more calm, practical, and medically responsible videos about healthy aging.